Americans' trust in the vaccine is not at levels which we will need in order to get to herd immunity, and there's a lot of question about what exactly we should do about it.
Journalist Zaid Jilani has proposed that the U.S. take note from Brazil's cash transfer program, that was called Bolsa Familia, and pay people to increase the vaccination rates, especially among underserved communities. And he's here to discuss that idea. Great to see you, Zaid.
Good to see you, Zaid.
Yeah, it's great to be here.
Yeah, I thought this was it's very straightforward, actually. Just pay people to get the vaccine, but just lay out your thoughts here in the context of the program in Brazil.
Yeah, so under President Lula, who was president some years ago, he was a center-left leader in Brazil. They started a program called Bolsa Familia. And basically what Bolsa Familia did is it delivered small amounts of cash, primarily to poor families, who agreed to do certain things. So they placed conditions on it. It was what was called a conditional cash transfer program. They placed conditions on it, including having your children vaccinated, maybe going to some, reproductive health type classes, also making sure your children attended school. They had various conditions like this. And what was really great about Bolsa Familia, and it's still in place now, even under a right-wing leader, it was so popular they didn't want to get rid of it. What was so great about it is that it accomplished two things at the same time. One, it halved extreme poverty in Brazil. So many people received the money that it actually ended up reducing the poverty rate, the extreme poverty rate in Brazil. I think something up to maybe a quarter of Brazilians or something took advantage of it. The second thing that it accomplished is it actually changed the behavior among a lot of people. It created more pro-social behavior. So more children received vaccinations, more went for checkups, school attendance rates went up. Basically, what the government of Brazil discovered is that this is a powerful incentive for people to do something which they otherwise maybe wouldn't do, or they'd feel like, well, maybe we're poor, we have bigger problems than going and getting a vaccine for a disease I probably never will have. This changed people's incentive structure. It changed what was available to them by offering them these kind of conditional cash grants that were ongoing for basically being involved in this behavior. And I think what you'll find if you look around the rest of the world is that these CCT programs, these conditional cash transfer programs, are very effective at getting people not only money into their hands so they can improve their own lives, but also getting them to agree to some behaviors which are fairly, I think, uncontroversial. They use them for girls' education in a number of developing countries. They'll increase cash grants to families who will send their young girls to school. So I think this is something that's promising for the United States. It's a way for us to look at, right now, I think we're trying to get people to vaccinate by having, President Obama and President Bush take a vaccine on camera. That's fine. I'm sure some people who are fans of them maybe will appreciate that. But we might need to go the extra step here and actually give people, particularly in a down economy, a financial incentive to do this as well. And something that we need to stimulate the economy. We know that the more money you get into the hands of working class people, lower income people, the more money they're spending on basic goods and the better it is for the economy. So it seems like a win-win here to do something similar here in the United States.
Yeah, this is what I'm really interested in, Zaid. And this is something which both has been proven to work, and it drops poverty. Of course, there's not a single discussion about it here in Washington. But one element I want you to talk more about is the buildup in social trust, because this actually might be one of the only areas where you could actually buy more social trust in America at a time where we probably need it more than at any other time.
Yeah, and I mean, look, I think that we have seen, so for instance, when George W. Bush did tax cuts, right, in the early 2000s, he actually branded those in the way that they sent them out to people. They branded it around his name. So even though a disproportionate amount of that money went to upper income earners, I think a lot of middle class people got those tax checks basically and said, hey, George Bush is giving this to me. I think a similar thing happened with Donald Trump with the stimulus checks. It actually probably built a little bit of political support for him. I'm sure when they go back and study it, they'll find it probably increased his vote total a little bit. So I do think that, this is a rational way to build social trust between people, because people understand that when they're actually getting benefits for doing what they're asked beyond and a benefit that's basically universal. I mean, economists always say the best thing to do is to give people cash, because they know what their needs are and they know what their interests are, and they'll spend it the way that they need to. So I think, there'll be plenty of people out there who say, I'm young, I'm healthy, I don't really need this, or alternatively, I can't afford it. But if you subsidize it, you pay people to do it, you change that calculation. And I think that'll build a lot of trust between people, because a lot of people are just are not used to getting anything from the government, period, right? They feel alienated from the government. They feel like it's a superstructure or entity that exists for other people's benefit, right? Or it doesn't, or exists to tell them what to do, but it doesn't necessarily do anything for them. And I think, currently, if we're talking about a vaccine, it's the first run, it's tested, but I can see why people would be skeptical. They would think, it's a 90% effectiveness rate. What if it doesn't work on me? There are reasons for people to not 100% trust this process, but you can sweeten the deal a lot, I think. If you start using these CCT programs that have been used in other places to win over people who are even more skeptical about other kind of pro-social behaviors.
And what do you make of the current state of sort of trust in a vaccine and willingness to take the vaccine if we don't have a cash program, which, unfortunately, we are very unlikely to have?
Yeah, I mean, it's unfortunate because I do think that when you look at surveys about this, there's a substantial number of people who are skeptical about taking it. I think under the Trump presidency, a lot of people felt like, okay, if you're a Democrat, maybe you felt Trump was rushing the process for political reasons. You felt a little bit skeptical about it. But I think now in polls, probably more conservative leaning people are skeptical about it. And Joe Biden will be the person who will be overseeing the distribution. So this partisan gap is certainly an issue. But the idea behind something like cash transfer program is that it would depoliticize it, right? That people would feel that it's beneficial to them. They need it in this economy, particularly. They need that transfer. And you also have to remember another thing that's a little bit hopeful, which is that you don't need 100% of the people to take the vaccine, right? You just need a critical number, a critical percentage to hit to where you have basically society-wide immunity. And once you hit that number, we'll be okay. But we have to boost the amount of people who can take it. And I think that, at this stage, it may not be as big of a problem in the first few months because it'll be very supply limited, right? And they'll be working on giving it to healthcare workers where there probably won't be any resistance, long-term care facilities, maybe teachers, people who work with people. But at some point, we are probably going to need to increase the number of people who are willing to take it. And I think hopefully, over some period of months, people's skepticism will decline. But the best way really to handle this is the way that I think Brazil handled people's skepticism towards taking vaccines or sending their kids to school or going to these checkups and classes. It's to actually provide some extra benefit to people beyond the vaccine itself, because a lot of people are skeptical that maybe, first round of a vaccine will be all that effective. And it's a natural skepticism that a lot of people have about medicine. They've had it for a very long time. Simply lecturing people may not be enough to overcome that.
Yeah.
And then Zaid, you're talking about the carrot approach. There's also the stick approach, which would be vaccine mandates. What do you make of that approach?
Yeah, I mean, historically in this country, we don't just mandate you to get a vaccine like as a law, everyone has to get it. What we do is we say that we gate certain institutions. So like we say, like if your kids want to go to school, to this public school, you will have to get a vaccination. And that is fairly effective, I would say, in terms of driving vaccination rates, although it's not 100% effective. You still see clusters of people who, for instance, get various diseases because there is kind of like an ideological anti-vaccination movement. And a lot of those people homeschool or they private school. This would hopefully reach those people as well. Because any kind of mandate that we do probably will be similar. It won't just be a blanket, everyone has to get it. We don't normally do that. What we do is we gate admission to certain institutions, and we say in order to reach those populations or to be part of that population, you have to get the vaccine. Doing something like this hopefully would reach people to whom that wouldn't reach, because there is a population that historically has been resistant to that, successfully resistant through alternative means. So.
Yeah, and especially since it's adults who, don't have to go to school, who are really disproportionately trying to reach. Zaid, great idea. Thanks so much for discussing it with us.
Thank you, Zaid.
Coming up, the president of United Rural Democrats discusses why Dems are not making any headway in rural America today when Rising returns.